Well, we're reaching the point in the legislative session when we find out, as my mother said, that actions speak louder than words. For the last several years, Republicans here in St. Paul and Washington have been vamping on the Affordable Care Act and the rising costs of health care coverage for Minnesotans, and they're right, the costs have gone up. But here's a chance to do something about it. And they're not only not going to enact it, they're going to try to pass legislation that would prohibit future legislators from coming to their senses and giving Minnesotans the option through a Minnesota Care buy-in to obtain health insurance coverage as much as 28% below the current market prices. Now, I don't know whose fingerprints are in this, but I don't think they came up to this on their own. I think you've got the big insurance companies, the healthcare, the big insurers who are don't want this competition, and whatever the reasons, I believe it's the legislators themselves to explain what they are. The result is, and I will veto any bill that has this prohibition in it, because the result is that they're denying good Minnesotans a chance to get more affordable health care and coverage, and it's just really unacceptable. So have back for the second time here, Teresa and Brian Ramsdahl, who worked late last night to get his planning done so he could be here. You know, to talk about the perspective from farm families, as well as Gary Rudich, president of Minnesota Farmers Union. There was a report that just came out that income for crop farmers in Minnesota dropped to $24,000 a year in 2017, which is about half of what it was the year before. So there's an incredible economic crunch they're facing, and then, as you'll hear, the kind of health care costs that they have are just unaffordable. And that's what this Minnesota Care buy-in is about. It's about making health insurance affordable for Minnesotans. So, Teresa and Brian, welcome. Welcome back. Please.
Just a couple of statements. We're Brian and Teresa Ramsdahl. We farm in southwest Minnesota near Butterfield. We raise corn and soybeans and cattle. Currently, our premiums with the deductible run at $33,000 a year. That financial burden is crushing us. Each year we continue to burn farm equity. Year after year we burn up equity. I mean, our savings. And we keep telling ourselves, if we can just hang in there another year, the legislature is going to do what's right and give some relief. And but I don't know if, with the declining crop prices, if how much longer a lot of farm families like us are going to be able to hang in there. Some of our neighbors have already dropped their health insurance, and I pray nothing catastrophic happens to them. And we're very desperate for the legislature to give this a try. Work for the people, not for the insurance companies. So, Therese?
So now we'll turn it over to Dr. Nemec.
Good morning. I'm Dr. Glenn Nemec. I am a family medicine doctor. I practice in Monticello, which is not quite as rural as Butterfield, but a good portion of the population that I serve is from that same rural demographic. And in the interest of full disclosure, I am also the president of the Minnesota Academy of Family Physicians. That's 3,200 doctors that are scattered around Minnesota, many of them practicing in those rural locations. And I'll tell you what I see in my office every day. I see lots of people who don't have health insurance, and they're having to pay for it out of their pocket. And when that happens, they don't come in because I'm expensive, okay? And when they don't come in, we don't get a chance to pick up problems when they're easy and inexpensive to take care of. We don't pick up problems until they come in and it's a big problem or a catastrophic problem. And along with big and catastrophic problems go big and catastrophic price tags. Second problem I see is people who have got health insurance, but it's health insurance with these huge deductibles, $5,000 and $10,000. Most people are not going to go through that whole deductible, so they're in the same position. They're having to essentially pay out of pocket, and we see the same kinds of problems. We need people to get coverage, okay? And it needs to be coverage that they can afford, and it's got to be coverage that will incentivize them to come in and get their preventive care so they don't run into problems in the first place, and coverage that will encourage them to get into their primary care providers so that they can take care of problems when they're small and easy and have small and easy price tags. Now, as usual with all things legislative, the devil's in the details. The program has to be done correctly. It needs to reimburse the doctors enough in these rural areas to stay in business. Lots of rural practices are hanging on a financial thread. It's way, way attractive for these doctors to look at what they can get guaranteed coming down to the cities and working for one of the big organizations in the cities, and then you don't have a doctor out there at all. Even for people who have health insurance, if you have the inconvenience of having to drive a long ways, you get the same problem. They don't come in for their primary care, they don't come in for their preventive care. So the program has got to pay the doctors enough. Medicaid reimbursement does not even pay overhead. Medicare reimbursement, which the plan is going to be based on, at least allows us to keep our doors open.
Good morning. My name is Dr. Nathan Chomilo, C-H-O-M-I-L-O. I'm a pediatrician and internist here in the Twin Cities. I want to thank Governor Dayton for inviting me here today, and I want to share my concerns about the proposed Medicaid work requirement legislation. Because of my work with Minnesota Doctors for Health Equity and the Minnesota chapter of the American Academy of Pediatrics, I know that many Minnesota doctors, health systems, and community groups share similar concerns. Medicaid work requirements won't save money, and they won't lift people out of poverty. What the requirements will do is create bureaucratic red tape and reduce health insurance coverage for those Minnesotans who are working. Because of work requirements, an individual fighting cancer could be kicked off their insurance while receiving chemotherapy. Or someone in the midst of an acute mental health crisis might be expected to manage this requirement while trying to recover. Our friends and family will be asked to scramble for the right paperwork while fighting for their lives. And our neediest families won't be spared. Families like those I take care of, where mom and dad are working split shifts, coming into our early clinic hours or our late evening hours just to make ends meet so they can avoid the costs of childcare. We know from years of research and experience that when adults lose coverage, children do as well. And children who benefit from Medicaid miss less school. Therefore, they do better in class. They get better paying jobs. They live healthier lives, and they pay more in taxes. Damaging Medicaid will damage our state's potential for years to come. There's no medical diagnosis for able-bodied or truly needy. These are derisive and fabricated labels meant to attack the dignity of Minnesotans living in poverty. Medicaid work requirements will not fix the high cost of health care. They will hit people while they are down. Ultimately, this is a bad solution in search of a problem, and it undermines common Minnesotan values that we support those who need it, and that we do so because it's right, not because we ask something of them. Our state faces a number of important health challenges, like the opioid epidemic, persistent racial disparities, and issues with access to care in rural populations. Policies that create additional barriers to health insurance are counterproductive. I urge the Minnesota legislature to instead bolster programs that work by passing a Minnesota Care buy-in. Unlike the Medicaid work requirement legislation, a Minnesota Care buy-in would improve access to affordable coverage for thousands of Minnesotans. Access to this type of affordable care and comprehensive health care will truly help lift Minnesotans out of poverty. Thank you.
Morning. Gary Werdish, I'm president of Minnesota Farmers Union. I'd like to thank Governor Dayton for putting this putting the Minnesota Care buy-in option on the table. It's an option that needs to be discussed. And I can remember back when this program got put in under the Governor Carlson and a bipartisan program about 26 years ago. I had neighbors of ours, good friends, dairy farmers. They came and they said they can afford health, they can buy health care, so have health care for their family. The Minnesota Farmers Union, we conducted the last 2 years rural voices listening sessions around the state, and this by far was the #1 issue that came up at every session, the high cost of health care. We had farmers telling us between the cost of the deductible and their premiums, they were paying anywhere from $25,000 to $45,000 a year in health care costs. The recent data shows in the last 5 years, the farmer's income is going to be down 50% and actually is showing a negative income for this coming year. As farmers, you deal with a lot of uncertainties. You deal with the weather. This spring, we're doing it a late planting, getting our crops started, but you're dealing with weather concerns, market concerns, potential trade agreements, potential trade wars. This is one area that the state legislature can do something, take some steps forward. That's as we visit with our members and with our Rural Voices discussion, that's what they're asking. They're asking for options, put options on the table. This is an option that is put on it, has been working. Governor has put it on the table. Will it fix all of our problems with the health care? Will it fix all of our costs with the health care system? No, but it will help some people. And I guess I would ask, what's wrong with helping some people?
Questions on this subject?
Governor, are you reconsidering your stance on the provider tax, given that that's what funds this, and if it were to be, if the buy-in option were to be implemented, you potentially would be going into a program that wouldn't have funding in a short period?
Well, they're on their way to destroying Minnesota Care if they eliminate that tax. Next year's legislative session will face the brink. I don't expect this legislative session to act on it. So they'd rather use it in attack me for proposing that it continue. But, you know, it's part and parcel the same. Obviously, if there's no funding for Minnesota Care, then there's no Minnesota Care buy-in possible, and maybe that's part of their strategy. You'd have to ask them, I don't know.
Would it be worth at this point renewing your fight for that extension of the provider tax?
You know, I knew when I proposed it that absent the absolute necessity to do it or face the consequences, which won't occur until next year, it wasn't likely to get considered. I mean, this was one of the top agenda items for the Republican majorities in our discussions to end the shutdown in 2011. They were insistent upon this close down without looking at the consequences. Well, next year they'll be looking square into the consequences, and they have to tell a couple 100,000 Minnesotans they're going to lose their affordable health care because of whatever reasons.
If I could you tell me what kind of pressures you have been under because of these extremely high costs of insurance? Could you move in front of the microphone? What kind of pressure does that put you under as a farm family? What does it do to you?
Well, it puts us under a huge financial burden. I mean, it lessens your options as far as improving your, be able to update your equipment, being able to pay the bank off at the end of the year. It's a burden all the way around.
So,
Where do you get your insurance now?
we purchase our plan through MNsure, but we are ineligible for benefits of MNsure at this point. Some of the other consequences that we experience, many farmers run their operation on a line of credit through the bank, and with our income decreasing as commodities continue to decrease, the bank is getting tighter and tighter. And so we find other ways to cut corners. Maybe it's our household, we cut corners. We cut corners with how we maintain our our cattle yard, cut corners, how we take care of or replace machinery or don't replace machinery. And we just say maybe next year, but we're getting to the end of maybe next year's as the commodity prices are going lower and lower. We may not, our banker has been taking care of us, but as the income decreases, so will our line of credit, and so how will we continue?
Are you thinking about putting insurance like other farm families?
You know, our next door neighbors and several of our friends have dropped their insurance. Brian is diabetic. We don't feel we can drop our insurance. We will do everything in our power to continue our insurance because of that. So we don't feel that's an option, but.
But you're seeing people around you lose their farms, you said.
Yes, and I don't think that the city people hear enough about that. The farm foreclosures and the farm sales are on the rise, and the suicide rates are on the rise. We worry about our neighbors and we worry about each other because of that. And we hope that this turns around soon.
Perhaps this is a question for Dr. Nemec. Is it Nemec? I'm sorry.
Nemec, yeah.
What I've heard from Republicans and also from the U of M healthcare economists is that because Minnesota Care reimburses at lower rates, that there is a risk that healthcare providers in rural areas might be driven out of business if this were to take place. How do you account for the fact that you say that they're hanging on by their fingernails, but that you still support this?
Well, if I open a practice in rural Minnesota and I see 100 tomorrow, okay, and I see 100% MNsure and Medicare patients, I'm out of business the day after tomorrow, okay? And so, you know, every time somebody with that reimbursement rate comes through the door, yeah, it puts a practice at risk. The current plan is going to reimburse at a Medicare rate. Now, nobody's going to be buying yachts in the Bahamas on Medicare reimbursement either, but it does allow us to keep the doors open, and it allows our patients to get in and get seen. I mean, you know, these are people that we live with. They're people that, you know, I'm in the Lions Club with. You know, they're on our bowling team. I see them in church. You know, we're willing to do that, okay, in order for these people to be able to get the care that they need. And the rates that are planned for this with the Medicare reimbursement, we're not jumping up and down and having a big party over that kind of reimbursement. But like I said, that allows us to keep the doors open at least.
The reimbursement rates either now or as the program gets underway are negotiable and changeable. But the legislature and their opponents to this are not trying to negotiate higher rates for providers. They're trying to abolish the ability of Minnesotans to afford this. If the rates go up, so instead of getting 28% lower premiums, they'll get, people can buy it at 20% lower or 15% lower. It's still a big advance. And we're seeing it right now, who's on whose side. Who's on the side of the people and who's on the side of the insurance companies.
Governor, as you head into negotiations to end a session, how important is this one of your must-haves? A Republican spokesperson just said this has zero chance of passing the legislature.
Well, then they should be held accountable for that stance, because they're going to impose even greater financial hardship on thousands of Minnesotans. There are 349,000 Minnesotans without health coverage now. The percent of people without insurance in Minnesota went in 2 years from 4.6% to 6.2%. You don't have that exactly, but it jumped up noticeably. And, you know, this is, and then as I said, they scream and shout and say, well, you know, health care is unaffordable because of the Affordable Care Act. Well, that may be one factor, but here's a chance to do something about it. Here's a chance to make a difference in the lives of Minnesotans. And If they're not going to pass it, I can't make them pass it, but I hope the people of Minnesota will hold them accountable.
Could you bring it up, though, in negotiations, somehow
I
give
certainly
them
will.
something they want? Is it something you're willing to bring to the table and trade
I'll
and negotiate?
I have a stack of items, a couple of volumes worth.
These don't sound like easy negotiations ahead here in the last 10 days.
Well, we'll have to see what's possible. Until they have to get their conference committees together. They have to agree on final bills. So they have one legislative version, and then we'll know what we're discussing. But I would like very much to see this pass. Not for me, I hesitate to personalize these issues because then it's about, well, let's not let the governor get what he wants. So let's not let the governor win. This is not about me. I've got health insurance. This is about people like the Rumsells who can't afford what they're available to them now, can't afford not to have coverage, and are being just put under tremendous emotional and financial stress, which the legislature is just turning its back on. Well, I should say Republicans and a few Democrats, but I think it's basically almost all the Republicans. I don't want to make it partisan except when it is. They're the ones turning their backs on real Minnesotans.
Other questions on this topic?
Governor, Republicans are staunch on this, and I follow up on the question that Mary was asking. What will you refuse to give them
I'm not
if they
going to
want?
get into negotiations. I don't know what their final bills look like. I'll have things that I'm looking for. They'll have things that they're looking for. We'll sit down and talk. I don't know what their list is, and I'm not going to get into speculating about that at this point. We're less than 2 weeks to go, so it'll become real very quickly.
Good on this topic?
You join me back in my office for a visit? Thank you so much. What time do you finish planning lesson? So, and what time do you get up this morning to come here?
About 5.
I finished at 1:30.
Oh, my goodness.
Fortunately, I had a short drive.
Oh, man. Thank you. Come on in the office, we'll visit. Well, I think the effort that the Rumsells made to be here shows how urgent this situation is for them and many other farm families like them. With that, I'd be glad to respond to questions.
Governor Dayton, what compelled you to write this letter to Minnesotans regarding the emergency school program?
I want people to be aware of what's at stake for their schools, for school teachers, and for their children or their neighbors' children. And I want the legislature to act, which so far the Republican caucus leaders are saying they're unwilling to do. They say that we don't have the money. We have a $329 million projected surplus for the next biennium, and they have enough money to provide up to $255 million for large corporations who've been parking their profits overseas and are now bringing them back. They want to give them tax-free cushion on that. I mean, to say they don't have the money is just not true. They just haven't made it a priority. And that's why I'm trying to dramatize this. I'll be on the road tomorrow in Rosemont and Rochester, and then on Thursday in Marshall and St. Cloud. And I'll keep traveling next week as necessary to keep pressing this case so that Minnesotans understand what's at stake here. 59 school districts are looking at various deficits. That's the number we know. There are probably more. Hundreds of teacher layoffs and other staff cutbacks. We had a third grade teacher just the other day from Winona, and he said that his class size this year is 17, and with the budget cuts and the cut in teachers, next year it'll be 27. I'm sorry, 29. 29, right? 29. So, let's nod their heads. Hopefully shake your head wrong. So from 17 kids, which he says is a reasonable size, to 29 kids in 1 year because of the lack of funding. And, we're just going to deny our kids the kind of education they need for their futures and for our state's future if we don't provide this kind of assistance.
Governor, when we asked Chair Loon about this, she said if you hadn't put so much money into 4-year-olds, into the pre-K program, you would have more money to do this.
Right. If we put more money into people, we wouldn't be short of money for people. I mean, if you look at that statement, it just says it all. We can't, Oklahoma has had pre-K for a decade. We can't afford to do it here in Minnesota. I mean, I think that comment is very revealing.
Governor, both the EPA and the Minnesota Department of Health have said radon is one of the most serious health issues we're facing, yet we found more than 80% of Minnesota schools are not testing for radon up to national standards. Is that acceptable?
No, it's not. And that was a shocking report. And first time I became aware of it, and I asked my staff to talk with legislative leaders and see if there's possible we could put into a school funding bill, if they can send me one I can sign, that would take the state guidelines and make them, put them in statute and make it requirements. It's just absolutely disgraceful that some school districts you found have not tested for radon ever. Others not for 20 years. I mean, I remember back in the 1970s when I had energy as one of my areas, radon was recognized as a really serious concern, and one where you have increased insulation within a building, the radon content goes up. So it's something you really have to monitor, and have children go to school thinking they're going to be safe from other sources of threats. To have some hidden killer like this, and have a school district not even bother to test for it. It's just disgraceful, and it should be put to a stop. And if the legislature can't act on it this session, I'll look to see what we can do by executive order or other means to get something in place that requires schools to do this until legislation can be passed.
Governor, the House is taking up Representative Zerwas's protest bill today as a standalone bill. Is it sufficiently narrow in scope to
I haven't looked at the current language, you know. I mean, talk about a non-problem, which is just, again, appealing to their political base. Why don't they do something about health care? Why don't they make health care affordable? Why don't they provide the schools with emergency assistance? Why don't they do the things that people in Minnesota need them to do? I haven't seen a protest out there for over a year, or for almost a year. So, you know, so what are they doing out there? They're dealing with issues that are playing to their base and playing to their politics and playing to their re-elections rather than serving the needs of the people of Minnesota. And now we got 2 weeks to go. We don't have a bonding bill conference committee. We're finally maybe getting a Senate a tax conference committee. You know, the budget bills are out there. They're just doing this kind of stuff for the politics of it rather than serving the needs of the people in Minnesota.
Governor, I imagine in the same category you would put the Veterans Homes Stadium funding. They're going to have a hearing on that tomorrow. I imagine your opinion has not changed on that?
Well, I support the funding for the Veterans Homes through the proper channel, which is a bonding bill. Those are capital investments. And I told Representative Anderson that when we met 2 weeks ago, and her response was, well, she doesn't have a domain over the bonding bill. She does over state governments, including the stadium. So, I mean, I understand that intent on her part, but say that I'm not in favor of the funding for the Veterans Homes because I don't support draining the Stadium Reserve Fund is just, as I said before, untruthful.
Governor, you're scheduled to meet with Senator Pratt, I think, later today or tomorrow. What do you expect to be talking about? Is it about the Met Council reform bill?
He asked for the meeting. He wants to talk about Met Council changes, and you know, I've said I'm not going to support any changes to the Met Council. I don't think they've been probably vetted. There are all sorts of different ideas and proposals, and so you know, that's my position. But anybody who wants to meet with me, I'm glad to meet with them.
Is there any common ground for some level of reform in the way it's represented that you feel you could be reached?
Well, there's always possible common ground, but well, again, I have to see the particulars of what he's looking to do.
Can you talk at all about your meeting with the Red Lake president?
It was a very, really informal meeting. He came with just himself and his wife. We talked about the opioid epidemic. I talked about the funding that I proposed for grants to tribes for their fighting opioid, and the fact that neither the House or Senate has included that in their bill so far, that I'm going to push for that and get down to the final negotiations. That was primary topic, really.
Didn't get an in-bridge?
No, we didn't talk about that at all.
Governor, the omnibus finance bill is going to conference committee beginning today at 3 p.m. I don't know if you're prepared to weigh in on whether or not you'll sign that. It certainly sounds like you've got problems with it, but are you cheered at least that they're taking it forward at this point? Is there enough time now for you to veto it if indeed that's what you do?
Question is, when are they going to reach an agreement? When are they going to get the bills to me? And then, you know, how much time remains after that if I don't sign them? So, I mean, the clock is under their control, and, you know, they shouldn't be at this point anyway. But they are, but there's still time, yes, if they can reach an agreement in a reasonable amount of time, like a couple of days, and, you know, then we'll look at it, and then we can negotiate on it.
Is it a reasonable assumption that you're going to veto this bill?
I'm not going to make any assumptions about them until I see what they are.
Everyone good? Do you have any updates on the wild rice sulfate bill that was passed yesterday?
Well, it passed yesterday. It's coming to me. I'll have something to say about it tomorrow morning.
Governor, this is going to be your final of 8 fishing openers this weekend you're going to be going on. What are your most favorite and least favorite moments looking back?
Well, the ones where I caught a fish are absolutely at the top of which I think has been the last 6 of them, not the first year, but since then. I mean, I'm not going to discuss the size of the fish. Maybe the least favorite was going out at 12:01 a.m. on 2011 and up in Grand Rapids, Lake Patagama, and said to the guide, "So is this a good lake for walleyes?" He says, "It's terrific in June." And we didn't get a nibble. You know, it's been rather humiliating when my lieutenant governors trumped me, as Lieutenant Governor Yvonne Pretner-Solon did, and last year Lieutenant Governor Tina Smith's boat had they found a hole in the Mississippi where they caught like 34 fish. Like Representative got tired of just hauling in fish, and I went down to literally the last 5 minutes before I caught one. So if I catch a fish, it'll be a success. They're great events, and you know the community's put so much into them and do them so very well, and I hope we get a decent break with the weather in terms of it staying dry and manageable in temperatures. So, but most importantly, the ice is out on Green Lake. Center box is still pretty thick on Lake Vermilion, so there's swim places, but we'll have a fishing opener. And then next year I'll be lucky if I can find somebody to go give me a worm. Thank you.